Understanding the Ketogenic Diet Course, Positioning and Learning Objectives. This lecture serves as a strategic review and synthesis of the ketogenic diet principles previously introduced in Module 1. While our exploration will be concise, it is designed to reinforce key concepts, provide critical context, and prepare students for more advanced nutritional discussions in upcoming course modules. Key focus areas. 1. Theoretical foundation. Quickly reaffirm the core metabolic principles underlying the ketogenic dietary approach. 2. Metabolic mechanisms. Briefly revisit how nutritional ketosis fundamentally alters the body's energy utilization and metabolic pathways. 3. Critical integration. Connect the keto diet framework with broader nutritional science and emerging research perspectives. Lecture rationale. By conducting this strategic recap, we aim to ensure all students have a consistent understanding of foundational keto diet concepts. Provide a refresher for those who might need to reinforce their previous learning. Set the stage for more nuanced discussions in subsequent course segments. The lecture will be deliberately structured to be concise, comprehensive, recognizing that participants have already been exposed to fundamental keto diet principles in the previous module. Introduction to the ketogenic diet. The ketogenic diet is a low-carb, high-fat, and moderate protein diet used to treat epilepsy. It aims to reduce glucose and increase ketone bodies in the blood. 70 to 90% of calories come from fat, while carbs and protein comprise the rest. Carb intake is limited to 20 to 50 g per day. The protein-sparing effect of ketosis is the nitrogen intake not incorporated into body nitrogen. The ketogenic diet is gaining interest in nutrition and health outside of therapy. It is popular for weight loss, mental clarity, and controlling food intake. It is recommended for management. Definition and principles. The ketogenic diet is a high-fat, moderate protein, low-carbohydrate diet that switches the body's metabolic state to ketosis. It reduces insulin and increases glucagon to utilize stored energy and stabilize blood sugar levels. Protein is kept moderate at 20%, and fatty acids are synthesized into ketones. The diet opposes the current advice of high carbohydrate and low fat intake. Ketosis was first used as a treatment for epilepsy and mimicked fasting-style therapy. The diet can induce a fasted state within 2 to 7 days and maintains positive effects such as reduced seizures, weight loss, and metabolic shift through consistent carbohydrate restriction and high-fat intake. Metabolic changes on a ketogenic diet. Metabolically, the ketogenic diet operates on a fourfold pathway. Carbohydrates are restricted so that glycogen and blood sugar levels fall. This leads to a decrease in insulin production. This hormonal change signals the body that it is fasting, which is part of the reason for the diet's popularity. Fewer carbohydrates cause the liver to use fat for fuel. The muscles and significant organs use this product of lipid metabolism instead of glucose. This is a simplified explanation of the ketosis process, but it illustrates how the diet works. Many different signs and symptoms illustrate that the body is in a state of ketosis, such as strange smells and changes in urine color. However, it is meant to transition back into a state of lipid storage where the body is seeking recovery, repair, and growth. As ketosis is a state naturally meant to end, yet a state meant to contribute to the efficacy of energy utilization and use in the body, we considered it essential to discuss its effects on the body, but also how it can be regulated in a deliberate way called fat adaptation. After this, we also considered some of the dangers of initiating a ketogenic diet and how to mitigate these adverse effects. Overall, our goal with this review is to present the best accumulated knowledge about what happens in the metabolic processes of ketosis and the ketogenic diet, and how that connection can be managed to realize a ketogenic diet. Ketosis and its mechanisms. Ketosis is a state where the demand for ketone bodies exceeds their use or disposal. It is accompanied by the accumulation of ketone bodies in body fluids. Blood is the leading site for testing ketosis in humans and animals. Ketones in body fluids are related to lipid synthesis and breakdown in adipocytes, and deviations from equilibrium lead to ketosis. Fat metabolism offers a superior alternative to glucose for the body's energy needs. It produces more ATP and generates ketone bodies that can fuel tissues, including the brain. However, the liver limits ketone body production to 5 to 10% of the body's energy requirement when glucose or glycogen levels are high. Fat metabolism also varies based on glucose, glycogen levels, and liver glycogen storage. Health benefits of the ketogenic diet. Mental health disorders like anxiety, depression, and neuroinflammation are widespread. Neuroinflammation is a key factor in mental health decline. A ketogenic diet can reduce inflammation, protect brain neurons, and promote brain tissue repair. The keto diet slows aging, aids weight loss, and enhances brain function. It also controls epilepsy symptoms, helps with weight loss and fat loss, manages diabetes, provides energy, and addresses hormonal irregularities and some forms of cancer. The diet improves blood glucose levels, manages insulin hormones, reduces inflammation, lowers blood pressure, reduces heart disease risk, and improves blood fat markers with omega-3 fatty acids. Weight loss and fat metabolism KD is the most effective strategy for achieving sustained weight loss. After 12 months, it resulted in sustained weight loss for overweight or obese adults. KD treatment also led to more significant weight loss and improved body composition. The KD reprograms metabolic pathways, mobilizing stored fat as ketone precursors. It provides efficient brain fuel and reduces insulin release, altering body composition and attenuating fat-related diseases. Evidence shows changes in psychological aspects, challenges in identifying weight loss, and effects on appetite. Unlike resistance training, KD, high-low protein, reduces weight and fat. Improved mental clarity allows for greater focus and concentration, enhancing cognitive abilities. It provides a more precise and sharper perspective on tasks and challenges, enabling efficient problem solving and decision making. With improved mental clarity, individuals experience heightened creativity and innovation, facilitating the generation of fresh ideas and perspectives. This heightened clarity fosters a deeper understanding of complex concepts and enables effective communication and comprehension. Additionally, enhanced mental clarity promotes emotional well-being by reducing stress and anxiety, improving overall mental health and resilience. Improved focus and concentration. Improved focus and concentration, enhanced muscle strength and endurance, better sleep quality, reduced stress levels, enhanced mood and overall well-being, improved cardiovascular health, increased metabolism and weight management, improved immune system function, enhanced brain function and cognitive abilities, increased flexibility and mobility, improved digestion and gut health, accelerated recovery after exercise, increased self-confidence and self-esteem, reduced risk of chronic diseases, improved longevity and quality of life. Better sleep quality. Better sleep quality is essential for maintaining overall health and well-being. Getting enough restful sleep allows our bodies and minds to function at their best. It promotes proper brain function, improves concentration, and enhances daily productivity. Additionally, quality sleep helps to regulate mood, reducing the risk of negative emotions such as stress, anxiety, and depression. By prioritizing a good night's sleep, we can improve our physical and mental health, leading to a happier and more fulfilling life.